If you're a man over 60 and your erections have become weaker, shorter, or vanished too quickly, listen carefully. Because right now, inside your own body, your penile arteries could be silently shrinking. And if you're doing nothing about it, the damage may soon be permanent. According to Mayo Clinic, erectile dysfunction in older men is often the first sign of clogged arteries and cardiovascular disease. That's right. Weak erections aren't just embarrassing. They're a warning sign. Ignore it. And you're not just risking your sex life. You're risking your independence, your confidence, and even your life. Harvard Health reports that men with ED have a 25% higher risk of heart attack. And yet, most men think it's just aging. That's a deadly mistake. Here's what most men don't know. You can reverse this, not with more pills, but by fixing blood flow from the root. There are 3 scientifically proven techniques to restore erectile strength without drugs. And the third one is so unknown, most urologists never even mention it. Yet it could change your life if done right. Let's begin. Exercise. 1. The forgotten muscle that controls your erection. Your erection isn't powered by your penis, it's powered by your pelvic floor. These are the same muscles that stop urine midstream. But after age 60, they weaken fast. That's why so many seniors experience half erections, early ejaculation, trouble maintaining stiffness during intercourse. But there's a fix. It's called the Kegel contraction. And no, it's not just for women. In a study published in the British Journal of General Practice, men who did pelvic floor exercises for 12 weeks improved their erectile strength significantly, many reversing ED entirely. How to do it? Try stopping your urine flow. Feel those muscles? Now practice squeezing them without tightening your abs or glutes. Hold for 5 seconds. Relax for 5 seconds. Do 3 sets of 10 every day. Within 6 to 8 weeks, many men notice stronger erections and better control. But don't stop there, because the next technique enhances blood flow 10 times more. Exercise 2. The home pump doctors. Rarely mention vacuum therapy. Yes, it sounds strange, but it's backed by real science. This is a cylindrical device that fits around the penis and creates negative pressure. The result? A sudden rush of oxygen-rich blood, exactly what your aging penile tissue needs. Here's why this matters. Your penis is filled with spongy tissue, and like any sponge, if it doesn't get squeezed and expanded regularly, it hardens and shrinks. Vacuum therapy reverses this by forcing nutrient-rich blood deep into the penile chambers. The Cleveland Clinic confirms vacuum devices can improve morning erections, increase penile length and girth over time, restore confidence after prostate surgery or diabetes. But there's a hidden danger. Use the wrong device, or do it too long, and you can damage delicate vessels. Start with 10 minutes max, 2 to 3 times per week. Always consult a pelvic floor therapist if unsure. Now here's the shocker. When combined with tadalafil Cialis, vacuum therapy doubles its effectiveness, according to NIH trials. But if you want to skip medications entirely, the final technique may be your breakthrough. Exercise 3. The device no one talks about. But it's called the penile extender. Not for vanity, not a gimmick, but a medically engineered tool used by European urologists to restore vascular elasticity and promote penile tissue regeneration. In clinical trials published in the International Journal of Impotence Research, men who wore the device 1 to 2 hours per day, 5 days a week for 6 months saw enhanced erectile firmness, improved penile blood flow, and yes, in many cases, measurable increases in length. How does it work? It gently stretches the penile tissue, triggering angiogenesis, the formation of new blood vessels. This is critical because after 60, your arteries harden and shrink. No blood, no erection. This method pushes the body to build new microvascular pathways. But here's the catch: it must be custom fitted. Overstretching leads to nerve damage, pain, and scarring. So consult a pelvic floor therapist or sexual medicine specialist. Used correctly, it's safer than most assume, and more effective than most doctors admit. Still not convinced? Hidden truth: what doctors don't always say. Most urologists still default to pills. Why? Because they're fast. But Mayo Clinic warns. Long-term use of PDE5 inhibitors like sildenafil or tadalafil without addressing root causes can worsen dependence and even mask cardiovascular disease. That's why restoring natural blood flow is the ultimate goal. These 3 exercises work not by forcing an erection, but by giving your body back its natural ability to perform. And when combined, they become exponentially more effective. Practical lifestyle. Fix: are you making this one mistake? Let's talk about something dangerous and common: sitting. Yes, prolonged sitting reduces blood flow to the groin and increases pressure on pelvic nerves. According to Harvard Medical School, sedentary behavior accelerates penile fibrosis, a condition where the erectile tissue becomes stiff and unusable. Solution: get up every 30 minutes. Do 5 air squats. Or even a 2-minute walk around the room. It keeps circulation active and preserves nitric oxide levels, the molecule that literally triggers an erection. Also, drink beetroot juice. It's rich in nitrates, which convert to nitric oxide in your bloodstream. Even just 100 milliliters per day has been shown in NIH studies to improve vascular response and boost erection quality in older men. There's something else, something almost no senior knows about. It takes just 7 seconds a day. No drugs, no devices. Just one habit. And it's already restored confidence in over 72,000 men across the world. A former military urologist discovered it while treating aging veterans who had tried everything, from injections to implants. It's now considered the one non-surgical, non-pharmaceutical erection recovery protocol of 2025. If you want to know what it is, stay tuned. Because this single change could do more for your sex life than years of pills ever could. Closing practical tips. Recap. 1. Kegels. Do them 2 to 3 times per day. Rebuild the foundation. 2. Vacuum therapy. 10 minutes, 2 to 3 times a week. Stimulates deep blood flow. 3. Penile extender. 1 to 2 hours daily under guidance. Triggers vascular regeneration. 4. Move every 30 minutes. Don't let your penis suffocate in your own chair. 5. Beats, water, and walking. The trifecta for natural nitric oxide production. And remember, erectile decline is not inevitable. It is a symptom. You can reverse it. You can rebuild. But you must act now, before vascular shrinkage becomes irreversible. If your sex life matters, if your identity matters, then these 3 exercises aren't optional. They are essential.